What if the miracle weight loss drug everyone's talking about is silently transforming your body in ways you never expected? While millions celebrate their dramatic weight loss on Ozempic, a darker truth is emerging from research labs worldwide. Behind the stunning before and after photos lurk 12 silent side effects that could permanently alter your health. Today, we're exposing what pharmaceutical companies don't want you to know about the hidden dangers of semaglutide. Warning, what you're about to discover might shock you.
Ready to uncover the truth? Here comes side effect number 1, the haunting Ozempic face. Dr. Paul Jared Frank, a celebrity dermatologist, coined the term Ozempic face after witnessing a disturbing pattern among his patients. Research published in Dermatological Reviews reveals that semaglutide causes rapid facial fat loss, leading to a hollowed, prematurely aged appearance that can add years to your face overnight. The science is terrifying. As your body rapidly sheds weight, facial fat pads disappear faster than your skin can adapt. Harvard Health research confirms that this phenomenon involves elastin and collagen loss, fat and muscle volume depletion, and excessive sagging skin. Unlike natural aging, Ozempic face strikes people in their 30s and 40s, creating deep sunken cheeks, prominent bone structure, and wrinkles that weren't there weeks before. What makes this particularly insidious is that facial fat, once lost, rarely returns naturally. Clinical studies show that patients experience significant facial volume loss, resulting in sunken temples, hollow eyes, and loose skin around the neck and jaw. The transformation is so dramatic that some patients become unrecognizable to friends and family. But this is just the beginning of what Ozempic does to your body.
Next, side effect 2, gastroparesis. Imagine your stomach suddenly forgetting how to digest food. That's gastroparesis, a condition where Ozempic literally paralyzes your digestive system. Research published in JAMA Internal Medicine reveals that GLP-1 agonists like semaglutide significantly increase the risk of this devastating condition. Gastroparesis occurs when the muscle contractions in your stomach become so weak that food sits there, rotting. Patients report feeling full after just a few bites, experiencing chronic nausea, and vomiting undigested food hours after eating. The condition can become so severe that solid food must be avoided entirely. Clinical data shows that gastroparesis patients face life-threatening complications, including malnutrition, dehydration, and bowel obstruction. What's truly frightening is that this condition often persists even after stopping Ozempic. Novo Nordisk's own safety data acknowledges delayed gastric emptying, but downplays the severity of permanent stomach paralysis that some patients experience. The financial burden is crushing. Patients face ongoing medical consultations, specialized treatments, and frequent hospitalizations. Many victims are now filing lawsuits against Novo Nordisk for failing to adequately warn about this life-altering complication. And if paralyzed stomachs weren't terrifying enough, wait until you hear about what's happening to people's pancreas.
Next, side effect 3, pancreatitis. Dawn Gentle trusted her doctor when she started Ozempic in 2018. 3 years later, she found herself in an emergency room, doubled over in excruciating pain. Her diagnosis? Pancreatitis, inflammation so severe it nearly killed her. Research published in Healthline documents multiple cases of GLP-1 agonists triggering this dangerous condition. Pancreatitis occurs when your pancreas literally begins digesting itself. The pain is described as worse than childbirth, a burning, stabbing sensation that radiates from your abdomen to your back. Clinical studies reveal that semaglutide stimulates the pancreas to produce insulin, but in already inflamed organs, this can trigger catastrophic damage. The FDA acknowledges pancreatitis as a serious side effect, yet many patients remain unaware until it's too late. Research shows that about 5 cases per 1,000 semaglutide users develop this condition, requiring immediate hospitalization and sometimes surgery. Even more alarming, some cases progress to chronic pancreatitis, causing permanent damage and lifelong digestive problems. What's particularly disturbing is that some patients develop pancreatic cancer during treatment. While correlation doesn't prove causation, the timing raises serious questions about long-term safety that researchers are only beginning to understand. But the assault on your digestive system doesn't stop there.
Next, side effect 4, gallbladder disease. Your gallbladder, a small organ beneath your liver, plays a crucial role in digesting fats. Research published in multiple medical journals shows that Ozempic dramatically increases your risk of developing gallstones and gallbladder inflammation. The mechanism is as simple as it is dangerous. Rapid weight loss causes an increased flux of cholesterol through your gallbladder, promoting the formation of stones that can block bile ducts. These blockages cause excruciating pain, fever, and jaundice, a yellowing of your skin and eyes that signals serious trouble. Clinical data reveals that gallbladder problems occur in approximately 1% of semaglutide users. What makes this particularly treacherous is that gallbladder attacks can happen suddenly, often requiring emergency surgery to remove the entire organ. Once your gallbladder is removed, you face lifelong digestive challenges and dietary restrictions. The FDA requires Ozempic's label to warn about gallbladder problems, but many patients report their doctors failed to discuss this risk. Novo Nordisk's own safety data acknowledges gallbladder disease as a potential side effect, yet the company continues to market the drug without adequately emphasizing these surgical risks. Patients who develop gallbladder complications face significant medical expenses and permanent lifestyle changes. As if digestive destruction wasn't enough, Ozempic may be silently attacking your thyroid.
Next, side effect 5, thyroid cancer. The FDA's black box warning on Ozempic packaging tells a chilling story. Animal studies revealed that semaglutide causes thyroid tumors, including cancer. While human studies haven't definitively proven causation, the potential for medullary thyroid carcinoma has researchers deeply concerned. Research published in JAMA Otolaryngology suggests that patients on GLP-1 agonists may be receiving more thyroid cancer diagnoses, possibly due to increased screening rather than actual drug-induced cancer. However, the European Medicines Agency continues investigating reports of thyroid abnormalities in semaglutide users. The mechanism involves GLP-1 receptors found on thyroid C cells. When Ozempic stimulates these receptors, it may cause cellular transformation that could lead to medullary thyroid cancer. This rare but aggressive cancer has a poor prognosis and often requires complete thyroid removal. What's particularly alarming is that people with family histories of medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2 are specifically warned against using Ozempic. Yet many patients receive prescriptions without proper genetic screening. The long-term cancer risk remains unknown, essentially making millions of users unwitting participants in a massive medical experiment. But cancer isn't the only threat to your future. Your eyesight might be at stake too. Next, side effect 6, sudden, irreversible blindness. Imagine waking up tomorrow and discovering you're permanently blind in one eye. Research published in JAMA Ophthalmology reveals a horrifying connection between semaglutide and non-arteritic anterior ischemic optic neuropathy, or NAION, a condition that causes sudden, irreversible vision loss. NAION occurs when blood flow to your optic nerve becomes blocked, essentially causing a stroke of the eye. Danish research involving over 44,000 patients found that semaglutide users had significantly higher rates of developing this devastating condition. The blindness happens suddenly, usually gets worse over several days, then stabilizes, leaving patients permanently disabled. Clinical data shows that diabetic patients on semaglutide were nearly 8 times more likely to develop NAION, while obesity patients faced 11 times higher risk. What makes this particularly cruel is that there's no treatment for NAION. Once your vision is gone, it's gone forever. The mechanism behind this devastating side effect remains unclear, but researchers suspect that rapid blood sugar changes might trigger vascular problems in the eye. With approximately 6,000 new NAION cases annually in the United States, even a small increase in risk affects thousands of people. The Danish Medicines Agency is now investigating this connection, but for patients who've already lost their sight, it's too late. Vision loss is catastrophic, but Ozempic's assault on your eyes doesn't stop there.
Next, side effect 7, diabetic retinopathy. The cruel irony of Ozempic is that while it controls blood sugar, it may simultaneously destroy your vision through diabetic retinopathy complications. Research published in medical journals shows that patients with existing diabetic retinopathy experienced worsening of their condition when starting semaglutide therapy. Diabetic retinopathy occurs when high blood sugar damages the tiny blood vessels in your retina. Paradoxically, rapid improvements in blood sugar control can temporarily worsen this condition, causing blood vessels to leak or bleed. Clinical studies found that 3% of Ozempic users experienced retinopathy complications compared to 1.8% taking placebo. The mechanism involves sudden changes in blood glucose levels that can trigger inflammatory responses in retinal blood vessels. Patients report sudden onset of blurred vision, floating spots, and visual disturbances that can progress to complete blindness. What's particularly disturbing is that this can occur even when diabetes appears well controlled. Research shows that patients with proliferative and non-proliferative diabetic retinopathy at baseline face higher risks for complications when using semaglutide. The condition can progress rapidly, requiring emergency laser treatments or injections to prevent permanent vision loss. Many patients report that their doctors failed to warn them about these vision risks. While your eyes are under attack, Ozempic is simultaneously destroying your muscle mass.
Next, side effect 8, muscle loss. What good is weight loss if you become too weak to enjoy your new body? Research published in the Journal of Cachexia, Sarcopenia, and Muscle reveals that Ozempic causes devastating muscle loss that can permanently reduce your strength, stamina, and quality of life. Clinical trials show that patients lose up to 13.9% of their lean muscle mass during treatment, equivalent to about 15 pounds of muscle. This isn't just cosmetic. It's dangerous sarcopenia that typically takes decades to develop naturally. Studies reveal that 38% of total weight loss comes from muscle rather than fat, creating a condition called skinny fat, where patients appear thin but have dangerously low muscle mass. The mechanism involves rapid weight loss without adequate protein intake or resistance training. As your body burns calories, it consumes muscle tissue for energy. Research shows that muscle loss continues throughout treatment, with some patients losing muscle mass faster than fat. This creates metabolic problems, reduced bone density, and increased risk of falls and fractures. What's particularly alarming is that lost muscle is extremely difficult to rebuild, especially in older adults. Patients report exhaustion from normal activities, inability to lift objects they previously handled easily, and a dramatic decline in physical capacity. The long-term consequences include increased risk of disability, hospitalization, and death. As your muscles waste away, your hair might be falling out too.
Next, side effect 9, hair loss. The cruel irony of achieving your dream weight only to watch your hair fall out in clumps. Research published in medical journals confirms that semaglutide causes a condition called telogen effluvium, widespread hair loss that can dramatically thin your hair or create bald patches.
Clinical studies show that 3% of Wegovy users and 4% of children experience hair loss, compared to virtually zero in placebo groups. The mechanism involves rapid weight loss shocking your hair follicles into a resting phase, causing them to shed simultaneously. This creates diffuse thinning that can take months to years to recover, if at all. What makes this particularly devastating is that hair loss often doesn't begin until months after starting treatment, when patients are already committed to the medication. Research reveals that extreme and rapid weight loss triggers hormonal fluctuations that disrupt the normal hair growth cycle. Stress from managing diabetes compounds this effect. The psychological impact is profound. Patients report feeling self-conscious, avoiding social situations, and experiencing depression as their hair disappears. While some cases recover after stopping the medication, others face permanent hair loss, requiring expensive treatments or hair transplants. Many patients weren't warned about this risk and feel betrayed by their healthcare providers. But the damage extends beyond what you can see. Ozempic may be quietly destroying your kidneys.
Next, side effect 10. Kidney damage. Your kidneys filter toxins and maintain fluid balance, but Ozempic may be silently damaging these vital organs. Initial safety data listed kidney injury among potential side effects, and while recent research suggests some protective effects, the relationship remains complex and concerning. The mechanism involves severe dehydration from gastrointestinal side effects like vomiting and diarrhea. When your body loses excessive fluids, your kidneys must work harder to maintain function. Research shows that patients with existing kidney problems may experience worsening function, particularly during the initial treatment period. Clinical data reveals that kidney problems can develop gradually, with subtle symptoms that patients often ignore. These include fatigue, swelling in legs and ankles, changes in urination patterns, and elevated blood pressure. By the time symptoms become obvious, significant kidney damage may have already occurred. What's particularly dangerous is that diabetes itself damages kidneys, and adding Ozempic to the equation creates complex interactions that aren't fully understood. While some studies suggest long-term kidney protection, short-term risks remain significant. Patients require regular monitoring, yet many don't receive adequate kidney function testing during treatment. As your kidneys struggle, research reveals that Ozempic might even be shrinking your heart.
Next, side effect 11, heart muscle loss. New research from the University of Alberta reveals a shocking discovery that should terrify every Ozempic user. The drug doesn't just cause skeletal muscle loss, it's actually shrinking heart muscle in both animal studies and human cell cultures. The research team, led by Dr. Jason Dyke, initially set out to study skeletal muscle loss, but discovered that cardiac muscle also decreased in both obese and lean mice. When they tested this effect on cultured human heart cells, they confirmed the same devastating result. This suggests that Ozempic may be systematically weakening the most important muscle in your body. While researchers haven't yet observed functional heart problems in mice with smaller hearts, the long-term implications for humans remain unknown. Your heart is a muscle that must beat continuously for your entire life. Any reduction in cardiac muscle mass could potentially affect its ability to pump blood effectively over time. What makes this discovery particularly alarming is that most patients have no idea their heart muscle might be shrinking. Unlike skeletal muscle loss, which you can see and feel, cardiac muscle changes happen silently. The research is so new that long-term consequences haven't been studied, essentially making every Ozempic user part of an uncontrolled experiment on cardiac safety. Finally, even your blood sugar control might become dangerously unstable.
Next, side effect 12, hypoglycemia. The final, silent threat lurking in your Ozempic injection is potentially deadly hypoglycemia, blood sugar levels so low they can cause seizures, coma, and death. Research published in medical journals shows that this risk dramatically increases when Ozempic is combined with other diabetes medications. Hypoglycemia occurs when your blood glucose drops below 70 milligrams per deciliter, causing symptoms like dizziness, confusion, sweating, and shakiness. In severe cases, patients lose consciousness or experience seizures. Clinical studies reveal that patients using Ozempic alongside insulin or sulfonylureas face significantly higher risks of dangerous blood sugar crashes. The mechanism involves Ozempic's complex effects on insulin and glucagon production. While the drug helps lower blood sugar, it can create unpredictable interactions with other medications, causing blood glucose to plummet without warning. Lifestyle factors like fasting, sudden dietary changes, or increased exercise can trigger severe hypoglycemic episodes. What's particularly dangerous is that hypoglycemia can occur hours after meals or during sleep when patients can't recognize warning signs. Research shows that elderly patients and those with kidney problems face higher risks. Severe hypoglycemia requires emergency treatment and can cause permanent brain damage if not addressed immediately. Many patients report that their doctors failed to adequately explain hypoglycemia risks or provide clear guidance on managing blood sugar while taking Ozempic. This oversight can literally be life-threatening.
The evidence is undeniable. While Ozempic delivers dramatic weight loss, it extracts a devastating price that extends far beyond what pharmaceutical companies acknowledge. From facial aging and blindness to muscle wasting and heart damage, these 12 silent side effects represent a catalog of potential horrors that every patient deserves to know. The most troubling aspect isn't just the side effects themselves. It's the systematic failure to adequately warn patients about these risks. Millions of people are making decisions about their health based on incomplete information, unaware that their pursuit of weight loss might cost them their sight, their strength, or even their lives. Before you take that next injection, ask yourself, is rapid weight loss worth gambling with your face, your vision, your heart, and your future? The research suggests that for many people, the answer should be a resounding no. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Please like this video, share it with someone who needs to see this information, and subscribe for more health truth that mainstream medicine won't tell you. Thank you for watching, and remember, your health is worth more than any quick fix.